Hello everyone, myself Sanjana Tanwar, an intern from Vedic Dental College Daman, and my topic for this lecture is base plate. So let's dive into it. Okay, so let's start the lecture base plate. Introduction. Bulk of removable appliances is made of base plate, as we all know that. Material used is heat cure or cold cure acrylic. Now I'd like to differentiate between heat cure and cold cure acrylic. The differentiation is a cold cure is frequently used as comparison to heat cure, but cold cure is less stable than heat cure. As well as cold cure, in cold cure the chances of porosity are more, while in heat cure are less, but cold cure is less time consuming and is simple to use, while heat cure requires a lot of procedures. Coming to the next point, it acts as support for pressure sores and distribute the reaction of this force to encourage. Below are the figures for like cold cure acrylic and heat cure acrylic. Coming to the uses part, it incorporates both the retentive and active component into a single function unit. As we all know, active component and retentive component are like the base plate helps them to hold in one place. Coming to the second point, it helps in anchorage and retention of the appliance in the mouth due to surface area. Surface area here is directly proportional to the retention and anchorage. Retention and anchorage. Third point, it helps resist unwanted drift during tooth movement. Fourth point, it distributes the forces from the active component over a large area. As I said it before, like the surface area is important here. It will help in retention, anchorage, as well as distribution of the forces. Then coming to the fifth point, it protects the palatal spring against distortion in the mouth. Sixth point, bite planes can be incorporated into the base plate and used to treat specific problem. We'll be discussing about the bite planes in the coming slides. Now thickness, 1.5 to 2 mm, mind this, 1.5 to 2 mm is sufficient as it provides adequate strength and is well tolerated by patient. It should not be thickened at the area where clasps are embedded because it will lead to instability of the base plate, and thickness is utmost important. Otherwise, if the base plate is bulky, it will be very hard for the patient and it is very discomforting. Third point, if thickness increases, then it will interfere the speech. As I said it earlier, it will be discomforting, it will be problematic in speech, then it will be very difficult and irritating for the patient. Then coming to the extension of base plate, for maxilla it should be distal to first molar, and for mandible it should be shallow to avoid irritation to the lingual sulcus. If it is more extended, then it will lead to irritation of the lingual sulcus and irritation. Like I will be coming to the next point. Problems due to overextension are nausea and discomfort to patient in terms of maxillary base plate. You know, the patient will be very nauseated and very discomfort, as I said it earlier. Now, for problems in mandible base plate are it will lead to food accumulation, then irritation to sulcus and displacement of base plate due to tongue. If it is overextended, when the tongue movements will be taking place in patient's mouth, it will lead to displacement and again it will give a very great discomfort to the patient. And as I said it earlier, it will lead to ulcer in patient's mouth. Now to correct if your base plate is overextended, corrections will be like for maxilla, it should be distal of first molar, as I said it earlier. Also, it is given in the figure below. And slightly cutting it forward in midline, which lead to strength and anchorage. As you can see, the U shape which is formed, it will give strength and anchorage to your base plate, right? Then for mandible, correction is done by blocking the undercut before acrylization, and it should snugly fit around the neck of the teeth. It should not be tight at the cervical area of the teeth, otherwise it will lead to gingival irritation. Like your gingiva will be severely irritated, marginal gingivitis basically. Then coming to the next point, Now here we'll be talking about the modification of base plate. Modification of base plates are bite planes, as I said it earlier, we'll be discussing here, and that are inclined and flat bite plane. Bite planes, they are extension or added acrylic which are usually incorporated into the design of a removable orthodontic appliance as an extension or modification of acrylic based framework. Usually bite planes are not incorporated until it is indicated, and it varies depending on the cases and requirement of the patient. Okay, now classification of base plate, on like it's a classification of bite planes. Okay, bite plane can be classified according to their location as follows. For anterior, it will be upper and lower, and for posterior as well as it will be upper and lower. Okay, so now classifying according to angulation as flat and incline. Flat is 0 degree and incline is 45 to 60 degree. Okay, now flat for upper is anterior flat bite plane, sweat bite plane, Sidlow's hollow bite plane, and posterior bite plane. And flat for lower is posterior bite plane. Okay, now coming to the incline, for upper it will be anterior incline bite plane, and for lower it is anterior reverse inclined bite plane, which is also known as Catalan's appliance. Okay, so coming to the anterior bite plane, as it is given, it should be flat to avoid, it should be flat, that is 90 degree, to avoid proclining forces on mandibular incisor teeth which will aid in posterior eruption. Okay, so here when we give this anterior flat bite plane, then there is a difference of 2 to 3 mm between the posteriors. Difference will be 2 to 3 mm. Okay, now this difference, suppose these are the posteriors, okay, and there is a difference of 2 to 3 mm between the posteriors. This will disocclude the posterior teeth, and as a result this posterior teeth will move towards each other. Okay, and this is how deep bites are corrected, while the cross bites and scissor bites usually requires clearance. Okay, now coming to the next point, extension should be till the region behind the upper anterior teeth, extending from canine to canine. It should be flat and parallel to the occlusal plane. As it is clearly shown in the diagram, extension is still canine to canine, and as well as it should be parallel to the occlusal plane. Okay. Height should disocclude the posterior teeth by 2 to 3 mm. As I said it earlier, the difference should be 2 to 3 mm. Okay. Thickness should be 4 to 5 mm. Third point, maxillary incisors may be capped to prevent flaring. It also aids in retention and increases anchorage. Okay. Maxillary incisors may be capped to avoid the flaring of the teeth. Okay. Now, indication of anterior bite planes are deep bite, cuspal interference and cross bite in posterior teeth, pain associated with TMJ disorders, as a diagnostic splint in TMJ pain cases, decreased lower facial height, and low FMA angle cases. FMA is Frankfurt mandibular plane angle. Then coming to the contraindication, high FMA Frankfurt mandibular plane angle, increased lower facial height, and severely protruded lower anterior teeth. Okay, so FMA angle is usually 25 degree. Okay, if it is more than 25 degree, then the patient is a vertical grower. Okay, the growth pattern will be vertical. Okay, and if it is less than 25 degree, the growth pattern is horizontal, and the bite planes are given according to the growth pattern. In horizontal, usually anterior bite plane is given, and in vertical, posterior bite plane are given. Okay, if we'll give anterior bite plane in vertical growing patient, it will worsen the case because it is contraindicated in increased lower facial height. Okay, coming to the uses of anterior bite plane, it is used for correction of deep bite and posterior developed cross bite in hypodivergent patient. Okay, as I said it earlier in the indication, deep bite cases and crossbite in posterior teeth. Posterior developed crossbite as it is given here. And seeing the diagrams, it shows that angulation of flat upper anterior bite plane in cross section. Okay, you can see the angulation. And second diagram shows the disocclusion of posterior teeth with upper anterior bite plane. As I said it earlier, the difference between the posterior teeth and the base plate, like for the posterior teeth to be disoccluded and to erupt, there should be difference of 2 to 3 mm. Okay, as also it is shown in the diagram, the difference here is 2 to 3 mm. Now modification of anterior bite plane is Sidlow's hollow bite plane. Now the indication for this is when there is severe proclination of anterior teeth and deep bite is present. Okay. Proclination of anterior teeth and deep bite should be present. It allows retraction of teeth by providing sufficient room behind the anterior teeth because it is hollow from inside. Retraction of teeth. It will help in retraction of teeth by providing sufficient room behind the anterior teeth because it is hollow from inside. Here it will be hollow. Okay. Then sweet bite plane. It is also modification of anterior bite plane. Modification of anterior bite plane where the acrylic base plate is extended onto the incisal 1/3 as it is shown in the diagram here below. Incisal 1/3 of labial surface of anterior teeth to prevent proclination of upper teeth. It is shown clearly in the diagram. You can see it should be extended up to incisal 1/3 of labial surface of anterior teeth. Now this is the labial surface, and the green color is the labial surface and the red one is the lingual or the palatal surface. Okay, and as you can see, the plate is extended till the 1/3, incisal 1/3. Okay. Now advantages of sweet bite plane is it will splint the teeth together. Okay, splinting, it will keep the teeth together, prevent them from getting proclined. It won't let them be proclining. And third is reinforce the anchorage as teeth can move as one unit only. Okay. Now for posterior bite plane, it is the extension of acrylic base plate over the posterior teeth as it is clearly shown in the photo below. It is an extension on the posterior teeth. Okay. The yellow color plate is the base plate. Now the height should be sufficient to free the teeth that are to be moved from occlusal interference with opposing teeth. Okay. Height should be sufficient to free the teeth that are to be moved from occlusal interference with opposing teeth. It is clearly mentioned and it is simple. Now coming to the indication, to give occlusal clearance for correction of crossbite for anterior teeth. Okay, anterior bite plane for posterior crossbite and the posterior bite plane will be for interior crossbite correction. Okay, it is opposite, like if it is posterior it will be correcting the anteriors, and if it is anterior it will be correcting the posteriors. Simple. Now for diagnosis of occlusal prematurities. Okay, then cases with TMJ pain dysfunction, it is same as that of anterior bite plane. Indications like almost the TMJ part. Now for the last one, for class 2 division 2 cases. As you know, class 2 division 2 is when the laterals are proclining and the lateral incisors are proclining and the central incisors are like they are retracted a bit. Now retention is achieved by Adams class von molars. It is clearly saying in the, you can clearly see in the diagram, sorry. Labial bow counters forward component of force on upper anterior teeth and it can be added as part of Holly's appliance. Okay, here the labial bow will be like the long labial bow. It will be present on the anteriors. Okay. Now coming to the lower inclined plane, that is Catalan's appliance. As you can see in the diagrams, it is only given in the anteriors and only the 4 anteriors lateral to lateral are covered in here. extension, adequate support should be present to prevent trauma to the lower anterior teeth. Okay, material used is acrylic or cast metal. Angulation will be 45 to 60 degree. Note this, 45 to 60 degree to the long axis of lower incisors. Steeper the plane, greater will be the forward pressure on the maxillary incisors. Okay. It is a functional appliance, that is, it works during function performed in the mouth. Okay, when the patient is chewing, at that time it will be working, like at that time it will be correcting the problem. Now, indication, developing anterior crossbite. Okay, as I said it earlier, it will be a functional appliances, like when the patient is chewing and performing the function in the mouth, at that time it will be correcting the anterior crossbite. Okay, with a good degree of overbite, and there is sufficient space for the erupting teeth, so it will be correcting the crossbite as well as the overbite. Now, contraindication, lack of overbite and crossbite due to true mandibular prognathism. Okay, true mandibular prognathism. Okay, so now coming to the upper anterior inclined bite plane, the indication are severely retroclined lower anteriors. Then the design will be the bite plane is inclined downward and forward at an angle of 60 degree to the occlusal plane. Okay, as it is shown in the diagram clearly. Now, uses of anterior inclined bite plane is, it will guide the mandible forward. Proclination of retroclined lower anteriors, as it is clearly written in the indication, severely retroclined lower anteriors. Okay, so it will be used in same. Reduction of overbite. It can also be used to reinforce the anchorage, as the lower anterior teeth engaging the bite plane exerts a backward pressure on the appliance. This is easy and I hope this is clear. Okay, here are the references given. I hope you like this video. Do subscribe this channel for more such informative videos. Thank you.